Getting sick in America isn't just about health, it's about money. Imagine being in a hospital bed, and instead of focusing on recovery, you're worrying about the bills piling up. For millions, a trip to the ER can lead to anxiety, sleepless nights, and even bankruptcy. The average American family is just one medical emergency away from financial disaster. It's not just the cost of treatment, it's the hidden fees, the insurance loopholes, and the endless paperwork. Healthcare shouldn't be a source of stress, it should be a right. Yet, here we are, navigating a system that feels more like a financial trap than a safety net. Imagine waking up in the middle of the night, clutching your stomach, feeling that familiar pang of pain. You know you should go to the hospital, but instead of focusing on your health, your mind races to the costs. The average hospital stay in the US can set you back over $10,000. That's a staggering amount, especially when you consider that a simple ambulance ride can cost anywhere from $1,000 to $5,000, even if you have insurance. Now let's break that down. You're already feeling vulnerable, and then you have to think about copays, deductibles, and those dreaded surprise bills that seem to pop up out of nowhere. It's like a game of financial roulette, and the stakes are your health and well-being. You might have insurance, but that doesn't mean you're in the clear. Many people are left drowning in medical debt, struggling to pay bills that feel like they just keep piling up. It's not just about the money. It's about the fear of what could happen if you don't seek help. Imagine being afraid to go to the doctor, not because of the pain, but because of the bill. That's the reality for many Americans today. You might think, I'll just wait it out. But what if that wait leads to a more serious condition? The irony is that the very system designed to protect our health can sometimes feel like it's holding us hostage. It's a paradox. Healthcare should be about healing, but for many, it becomes a source of anxiety and financial strain. And let's not forget the stories we hear. A friend goes in for a routine procedure, and suddenly they're hit with a bill that's more than their monthly rent. Another person avoids the emergency room, thinking they can tough it out, only to end up in a worse situation later on. This isn't just about numbers, it's about lives. It's about families being torn apart by the stress of medical bills. It's about people making choices between their health and their financial stability. We need to talk about this. We need to advocate for a system that prioritizes health over profit. A system where going to the doctor doesn't feel like a gamble. Because at the end of the day, everyone deserves access to care without the looming shadow of debt. So, the next time you hear someone say, just go to the doctor, remember that for many, it's not that simple. It's a complex web of fear, financial strain, and the desperate hope for a healthier future. We need to change the conversation around healthcare in this country, because everyone deserves to feel safe when it comes to their health. Healthcare in America is a complex web of costs that often leaves us scratching our heads. Let's dive into why it's so expensive, focusing on pharmaceutical prices, administrative costs, insurance loopholes, and corporate profits. First, let's talk about pharmaceuticals. The price of prescription drugs in the US is staggering. A single medication can cost thousands of dollars, and it's not uncommon for patients to choose between paying for their medicine or paying their rent. Why is this? A big part of the problem is the lack of price regulation. In many other countries, governments negotiate drug prices, but here, pharmaceutical companies set their own prices. They invest heavily in marketing, flooding our screens with ads that promote their latest miracle drugs. But the reality is that those costs are passed on to us, the consumers. Now, let's shift gears to administrative costs. Did you know that the US spends nearly twice as much on healthcare administration as other countries? A significant portion of our healthcare dollars goes to billing, coding, and navigating the labyrinth of insurance claims. Hospitals and clinics are bogged down by paperwork and red tape, which drives up costs. Instead of focusing on patient care, healthcare providers often find themselves wrestling with insurance companies and their convoluted policies. Speaking of insurance, let's address those loopholes. Insurance companies are designed to make a profit, and that often means finding ways to deny coverage or limit benefits. High deductibles and out-of-pocket expenses can leave patients in a bind, forcing them to delay necessary treatments or forego care altogether. The system is set up to prioritize profits over people, and it's the everyday Americans who bear the brunt of these decisions. And then there are corporate profits. The healthcare industry is one of the most profitable sectors in the country. CEOs of major health companies often earn exorbitant salaries, sometimes in the tens of millions, while their companies cut costs in ways that can negatively impact patient care. This focus on profit over patient well-being creates a system where the bottom line takes precedence over health outcomes. The truth is, the system isn't broken. It was built this way. It's a structure designed to benefit corporations and their executives, not the individuals who rely on healthcare. Everyday Americans are left to navigate this maze of costs, often feeling powerless against a system that seems rigged against them. As we continue to grapple with these issues, it's crucial to understand that we have the power to demand change. We need to advocate for transparency in pricing, push for regulations that rein in pharmaceutical costs, and hold insurance companies accountable for their practices. It's time to shift the focus back to patient care and ensure that healthcare is a right, not a privilege. The stakes are high, and the cost of inaction is simply too great. Every day, I sit at the dining table, bills piled high, and the weight of medical debt presses down on my chest. I can't shake the fear of getting sick. It feels like a shadow lurking in every decision I make. Delaying care to save money only leads to worse health and even bigger bills. It's exhausting. Anxiety creeps in, and I find myself awake at night, staring at those bills, feeling trapped. This isn't just about finances. It's about my mental well-being. The stress of healthcare costs isn't just a number. It's a heavy burden that affects my entire life. Every day, I see the weight of the world on the shoulders of parents hustling through multiple jobs just to keep their families afloat. They wake up before dawn, juggling shifts, and racing against the clock, all while trying to make sure their kids have what they need. But what's really keeping them up at night? Health insurance premiums. It's a cruel irony that while they're working harder than ever, they're also battling the rising costs of healthcare. It's not just about putting food on the table. It's about making sure their kids can see a doctor when they need to. Then, there are the young adults, fresh out of college, who are already feeling the weight of student loans pressing down on them. They're trying to navigate their new lives, but the thought of a doctor's visit feels like a luxury they can't afford. They skip checkups, thinking, "I'm young, I'll be fine." But the reality is that avoiding healthcare can lead to bigger problems down the line. It's a vicious cycle. They're trying to save money, but in the end, they might end up paying more for their health down the road. And let's not forget about our seniors. Many of them are living on fixed incomes, and every dollar counts. They're faced with tough choices every month. Do I buy groceries, or do I fill my prescriptions? It's heartbreaking to think that they might skip medication just to make ends meet. They've spent their lives contributing to society, and now they're left to choose between their health and their financial stability. This is a common issue in America, and it's not just a statistic. It's a reality for millions of people. The system feels rigged against those who are working hard and trying to do the right thing. It's frustrating to see how the very people who contribute to our economy are the ones struggling the most to access basic health care. We need to talk about these issues openly. It's time to advocate for change, to push for policies that support families, young adults, and seniors alike. Everyone deserves access to health care without the fear of financial ruin. It's not just about health. It's about dignity, respect, and the right to live a healthy life without the constant stress of financial burden. Let's keep this conversation going. Because if we don't, who will? The struggles are real, and they affect us all. It's time to stand up and demand a system that works for everyone, not just a select few. Navigating the world of healthcare can feel overwhelming, especially when it comes to managing costs. One of the first steps in coping with medical expenses is knowing your insurance inside and out. Take the time to read through your policy. Understand what's covered and what isn't. Don't hesitate to ask for written estimates before any procedure. This simple act can save you from unexpected bills that can throw your budget into chaos. Now, let's talk about negotiating medical bills. Many people don't realize that hospitals often have programs in place to help patients manage their costs. If you find yourself facing a hefty bill, pick up the phone and ask about discounts or payment plans. You'd be surprised how often they're willing to work with you. It's not just about what you owe, it's about what you can afford. Another great resource is free or low-cost clinics. Community health centers are scattered throughout the country, providing essential services at a fraction of the cost. They often offer sliding scale fees based on your income, making healthcare accessible for everyone. If you're struggling to pay for care, don't overlook these valuable resources. Prevention is key. By focusing on a healthy lifestyle, you can significantly reduce long-term healthcare costs. Regular exercise, a balanced diet, and routine checkups can help you avoid serious health issues down the line. Remember, an ounce of prevention is worth a pound of cure. Mental health is just as important as physical health, especially when dealing with the stress of medical bills. The financial burden can weigh heavily on your mind. Seeking support through therapy, joining a support group, or even connecting with online communities can provide relief. Sharing your experiences and hearing from others can make a world of difference. You can't control the healthcare system, but you can control how you prepare and respond to it. Equip yourself with knowledge, seek out resources, and prioritize your well-being. By taking these steps, you'll not only manage your medical expenses better, but also empower yourself to face whatever challenges come your way. America spends more on healthcare per person than any other country, yet we consistently rank lower in health outcomes. It's a staggering contradiction that raises a critical question. Why? The answer lies in a system that prioritizes profit over people. While we have some of the most advanced medical technology and skilled professionals, access to care remains a privilege rather than a right. Look at other nations. Countries like Canada, the UK, and Sweden have proven that affordable, universal healthcare is not just a dream, but a reality. They've implemented systems that ensure everyone has access to the care they need without facing financial ruin. So what's stopping us? The answer is complex, but it boils down to systemic issues deeply rooted in our political and economic structures. Grassroots movements are emerging across the country, fueled by the voices of everyday people who are tired of being ignored. Activists are rallying, holding signs that demand change, and engaging in debates that challenge the status quo. They're not just advocating for healthcare reform. They're fighting for a fundamental shift in how we view health as a human right. Another great resource is free or low-cost clinics. Community health centers are scattered throughout the country, providing essential services at a fraction of the cost. They often offer sliding scale fees based on your income, making healthcare accessible for everyone. If you're struggling to pay for care, don't overlook these valuable resources. Prevention is key. By focusing on a healthy lifestyle, you can significantly reduce long-term healthcare costs. Regular exercise, a balanced diet, and routine checkups can help you avoid serious health issues down the line. Remember, an ounce of prevention is worth a pound of cure. Mental health is just as important as physical health, especially when dealing with the stress of medical bills. The financial burden can weigh heavily on your mind. Seeking support through therapy, joining a support group, or even connecting with online communities can provide relief. Sharing your experiences and hearing from others can make a world of difference. You can't control the healthcare system, but you can control how you prepare and respond to it. Equip yourself with knowledge, seek out resources, and prioritize your well-being. By taking these steps, you'll not only manage your medical expenses better, but also empower yourself to face whatever challenges come your way. Healthcare should heal. It shouldn't destroy your peace of mind. Imagine facing a medical crisis, and on top of that, the burden of overwhelming medical bills. It's a reality that millions of Americans know all too well. You're not alone in this fight. Every day, families are grappling with the stress of healthcare costs, feeling the weight of financial strain when they should be focusing on recovery and well-being. The truth is, getting sick shouldn't mean going broke. Yet, for many, that's the harsh reality. We live in a country where the cost of care can feel like a mountain, and the fear of financial ruin looms large. It's time to change that narrative. We need to come together to raise our voices and demand a system that prioritizes health over profit. Healthcare should be a right, not a privilege. It's about more than just numbers on a bill. It's about lives, families, and futures. When someone is diagnosed with a serious illness, their focus should be on healing, not on how to pay for treatment. We need to advocate for policies that ensure affordable care for everyone, regardless of their income or background. Let's support one another in this journey. Share your stories, your struggles, and your victories. By spreading awareness, we can shine a light on the issues that plague our healthcare system. Together, we can push for change that makes healthcare accessible and affordable for all. So, if you believe that healthcare should be a source of healing, not a source of stress, share this video. Let's unite in this cause and work towards a future where no one has to choose between their health and their financial stability. Together, we can make a difference.